Hello everyone, this is Claire, founder of StudentRDH and Wake Up Memory Technique. So today I have the 2019 guidelines and I have dissected that for you already. So I had my highlighter, I put some marks on the PDF, and I also made an awesome cheat sheet. So basically a summary of everything you really have to know. The reason I've done that is because I want you to be successful in your dental hygiene board examinations. So I'm going to flip the screen and show you what I have marked and go to the points one by one so you really understand the format and you are ready for the examination. So this one, let's look at it in a PDF. Okay, so now you can see my screen actually, and what I have here is side by side the actual 2019 guideline and the summary, the blueprint report that I have for you. So here, let's just start scrolling down. This is a 29-page document, and it starts with some just table of content of what you're going to see within this blueprint. And it gives you an overview what the NBDHE means, what the purpose of it, but I'm just going to skip that. You can read that on your own. And I'm only going to highlight what's really important for you. So here we are here at page, I believe, 7. Yep. Because I also put in the report what page this was on, so you can go back to it and really read what I'm talking about. So I highlighted this, and you can see that in 2018, the American Academy of Periodontology, AAP, published a new periodontal and peri-implant disease conditions classifications. But you have to see here, they will not use it, okay? And it will continue to be based on the 1999 AAP disease classifications. So this is something you really have to understand in order for you to pass the boards. You're not using the new classification. They probably didn't have time yet to really update all their question bank. So focus on the 1999. So if you are having a textbook right now about periodontology, or a review book, or even StudentRDH, it will probably be based on the old AAP classification, which is good because that's what you have to know. However, if you are at school and your teacher has the new classification, you were taught on that, be careful. You want to actually read the old classification, okay? So make sure the date of the classification. And here in the special announcement section, I talk about this. I also say that at StudentRDH, we only have the old classification, so you are not confused. All right, so that was one major announcement that they made that you really had to pay attention to. If you did not get this information, you probably will have to. You probably would have studied with the new guidelines. But again, we are looking at the old guidelines. If your friends don't know it, if even your professor don't know it, please tell them, refer them back to page 7 of this blueprint. All right, so now let's continue. So the second portion, this is actually the summary that I have, and I'll actually show you where you can get that from. So if you go here at StudentRDH, and I have my tab to be small right now, but if you go under National Boards and you say NBDHE FAQ, there's an area where you can actually put your email, your personal email preferably, and you will get this download, okay? So the summary in your email box, so you don't have to keep looking at this video or download the entire guideline, okay? So just go here at studentrdh.com, it's under NBDHE, and find the FAQ. All right, now you know where it is. Let's continue. Now, scope of the examination, meaning what are they going to ask me, right, when you have to the examination? Well, first of all, you need to know that there are 350 questions. And again, that's page 7. 350 questions divided into 2 components. And here in the blueprint summary, I have it here. 200 items are what they call discipline-based components, such as something that is more like basic science, as you can see over here, provision of dental hygiene clinic services, such as patient care, and also community health and research principles. So those are 200 items. And after that, you have what's called the case-based component, case studies, 150 items that refers to 12 to 15 patient cases. In total, you will see 350 questions. Now let's dive a little bit deeper into those 350 questions. Now I'm just going to scroll down here. This is the blueprint. And if you see here, they give you some bullet points about what it means to be in the provision of clinical dental services. What does it mean to, for example, be in the section of community health and research principles. So you have bullet points, and what you can do is you can go through them one by one and get a check mark. Okay, get your own system of check mark to see, for example, if you say, okay, fluorides, which is spelled like this right now. This is the blueprint. I didn't make it. Maybe we should tell them. So if you see fluoride, for example, mechanism of action, do you understand the mechanism of action? How, for example, the chemical binds into our enamel surface and how it creates a fluorapatite, for example. If you have this image in your head and you understand the concept, maybe you can put a check mark and go down the list one by one, and you will be able to find your weaknesses. This is what I would suggest. All right, let's continue. Now we talked about here community oral health. Well, this is really important to know, and we're going to understand here in the blueprint summary that I have provided to you. Again, you can go to StudentRDH.com and get it. That this is an example of what a community oral health testlet looks like, because this section of community health and research principle will use this testlet format. So you will have a scenario. In this case, it's a community profile with someone went to do a DMFT survey, and they have some numbers to share. Now from this, you can go through the questions 1, 2, 3, 4 and find the answer. So this is a testlet, and that is used again for community health and research principles. Now you might ask, what are case studies? Well, case studies are, scenario with the patient chart, with their profile, their photograph, and their radiograph. So all of those combined makes one case study. And after each case study, you will see 7 to 13 associated questions. This is again from the blueprint summary that we have at StudentRDH. So how many case studies would you see? Well, 12 to 15. Well, why 12 to 15? Because everybody has a different set of examinations. So your friend might have 12, you might have 15. It really depends. Okay, but here what it says, they will find the following types of patients: geriatric, adult periodontal, pediatric, special needs, and medical compromise. So know that when you're studying, you have to understand the medical and dental condition of all of those patients. Okay, geriatric, pediatric, special needs. For example, if you think about medical compromised patient and the patient was taking hypertension drugs, which type of hypertension drugs would be related to gingival hyperplasia? So those could be one of those questions, right? So make sure that when you're studying, you are looking at those groups of patients. Now the case study here, the screenshot you have is from StudentRDH. This is not from the NBDHE. Obviously, I cannot go there and go take a screenshot. They probably will ban me forever from the services. However, this is our own mock exam that we have that you can take if you are with StudentRDH national boards. And again, every case study features those 4 different areas for you to dissect in order to go through the questions. All right, now let's talk about what type of questions would you see. You already saw the testlet, you already saw case studies, but actually, how many answer choices do I have in a question? So those, the answer is here. And right now I'm looking at page 10 of the NBDHE 2019 guidelines. And you can see there are 4 different type of question here. Completion, meaning, for example, this one, the cluster of Sebastian glands observed on the buccal mucosa is, and then you have to complete the sentence. The second type of question is what they call the question, meaning at the end, you have to just answer the sentences that end with a question mark. So it could be something like this. Which type of hypersensitivity has the most delayed response? And you have type 1, 2, 3, and 4. The next type of question is called negative. All right, you probably have seen those in your school examination. You probably struggled with those as well sometimes, right? It's except one is false type of question, but you will see those in the examination. Okay, so make sure you practice them. And also at StudentRDH, we incorporated those questions in order for you to continue practicing. Now the 4th type of question is called the pair true and false. You've probably seen this again in school examination or any book you're studying with, is There's a combination of first and second sentence, and you will be able to find whether the first and second statement are both true, both false, or one is true and one is false. Here in this blueprint, I gave you some question types, and I also gave you some answers so you can practice, okay? All right. Now, how many answer choices do you have per question? Usually 3 to 5, okay? Sometimes it's 3, sometimes it's 5, sometimes it's 4. Generally 4, but know that sometimes it's 3. They're not making a mistake, and sometimes it's 5. They're not trying to trick you. Now, there's another thing I want you to look at. So here, I'm going back to the blueprint, and it says something, best option. All right. Why do I want to highlight this? Because sometimes all of the answers make sense, especially in community oral health. When you see a testlet and they're trying to test you on a specific scenario where all of those are great recommendations, for example, for this geriatric patient, you just have to find the best answer. So what I'm trying to say is that sometimes it will be correct answers and sometimes it will be best answer. Now, it's always hard to find the best answer when everything makes sense, right? But this is just the mentality we have to get to. Everything are are good answers. Sometimes we just have to find the best, right? And sometimes we only have one correct answer and the rest are false. The reason I'm really emphasizing this because students sometimes feel like they are in the examination and they think, oh my God, they want me to fail. They're tricking me right now. Everything makes sense. And they are actually doing that on purpose, really to test your abilities. If you can find the best answer among everything that makes sense, they know you're a good student. So that's why they do that. All right, let's not be discouraged. Let's continue. We talked about the testlet already, and we talked about the case studies already. Now let's continue here. Again, this is the blueprint summary that I have. It's at StudentRDH.com under NBDHE FAQ. You can download it and read it again, and again. Now you're probably curious about what actually happens the day examination and what is actually the schedule like, and also when you're going to receive your results, right? So here it is. I'm jumping into the schedule because it's really important to understand how the entire day is going to work. So you have 2 sessions actually, session 1 and then you have session 2. However, session 1 is divided into 2 different session 1. The first 100 question, you take a break, and then you get to the second part of session 1 with another 100 questions and then a break. And then you go to session 2, there's the first part with 75 questions, then a break, and then the second session with another 75 questions, and then the post-exam survey. This is optional, right? What is optional in the entire thing are the breaks. So they say scheduled break, saying after 100 questions, you have a break that they give you for 15 minutes. You can use 1 minute of that, 15 minutes of that, none of that. That's up to you. However, the benefit of using the scheduled break is that you can go to the restroom, for example, and the timer is not running because it is a scheduled break for you. For example, if you were going to the restroom here, you were at item 50 of the first component, you wanted to go to the restroom, well, unfortunately, you cannot say stop or pause like your washing machine and come back. You have to just let the timer run and then you'll be able to come back. But by then you would have lost 3 minutes or however many minutes it took you to use the restroom or refresh your brain. However, if you feel like you need to take a break, I advise you to do so. So this is the schedule and we're going to talk about it a little bit more later. Okay, stay with me. Now the scores, okay, we all want to know what the passing score is, right? So you can find this information over here, score of the examination. It says the minimum is 75. However, 75 is scaled, okay? So you can get, for example, 80 and still score 75, or you can scale you can get 60 questions right out of 100 and that counts as being 75. Now, we don't really have to worry about that because we never know how it is going to be scaled. The reason why it's scaled is because, let's say they had 350 questions, and they look back and say, everybody failed this one question, so maybe they're going to throw one question out. Then suddenly you're graded again 349 questions. So you can understand that some things can change within the examination after you have taken it before they release the scores. That's why it's called scaled. However, there's nothing we can do at that that point. Therefore, all we can do is just focus, try our best, study our best, and then go to the examination being confident and submit it. Now, you will have a fail report, okay, if you fail. However, if you pass, you're just going to say pass. And all you have to do is go online and go to my account summary page. When you fail though, and hopefully that does not happen to you, you will see this different sections, for example, periodontology, and you will see how you perform versus the national average. For example, your score is 70, but now the national average was 80. So you know, for example, in periodontology, you did not do so well. Some other areas, for example, let's say community oral health, you did better than the average, right? So, you know, let's not worry about this fail report, but if that happens, you can always email me. I have some examples of how to read the fail report, but let's be positive here and let's focus on passing the exam. It says that you will get your results 3 to 4 weeks. However, at StudentRDH, you know, the students have reported to get their results within the week or two following the examination. So just keep going online, my account summary page, and you will see the update of whether pass or fail. I know it is going to be one of the hardest things you'll have to do. You just have to sit tight and maybe ask someone else to check it for you, because I can only imagine how nerve-wracking it is. All right, so let's continue down. I would like to share with you what the day of the exam would look like, and this is again from the NBDHE guideline that I have here on my left side. There are 29 pages, and I put a summary together for you here on the right side. You can download it at StudentRDH.com. You will find this section that's called NBDHE FAQs. Now, we are talking about the day examination. What do they want you to do? They want you to come 30 minutes early. This is again in the blueprint. I just put a little summary over here for you. You will need one government ID. Okay, you will need a secondary ID with your name, which means your debit card, library card, credit card. And all the items will have to be stored in the designated locker, and they will give you some notes. It's more like, I would say, laminated sheets and with some Sharpies. You cannot erase them, but you can use them to maybe do some calculations, to write down some important numbers. And also, you can have as many unscheduled breaks as you need. However, you cannot access personal belongings. When you go to a restroom, you cannot take your phone or take any of your textbook and read them, right? That just makes sense. All right, so we are looking at the day of the examination. Now, this is the blueprint. It gives you all this great guideline about what you really have to know. However, there are some things that they don't tell you, that they don't have here, but we know is happening. And this is really important. Please pay attention, okay? All right, so I'm gonna just make it bigger because this is really, really important. Okay, here it is. Information not available on the blueprint, but we have it here at StudentRDH. Again, you can download it by going to StudentRDH.com, and you will find this section that is called NBDHE FAQ right over here. All right, so I'm going back here to the summary. Hypertension guidelines. This has been a question since last year, 2018. Are they gonna use the new guidelines or not? Because the American Heart Association updated their guideline in 2017. However, they decided not to use it. They decided that they're going to keep the old information, okay? So please make sure that you review only the old information, not the new one. Now, it's a bit of difficult because when you are at school and they teach you the new guideline, they might not actually go back to the old guidelines. However, for the examination, you have to know that. So if you are with a professor who are teaching you only the new guideline, maybe you can tell them, suggest them that the NBDHE said that they would actually use the old guideline. Now, how do I know this? Because I know this, I emailed them. I emailed them as soon as they got the guideline. I saw that they didn't have this hypertension guideline area on it. So I emailed them saying, hey, what happened to the hypertension guideline? Are you guys going to update it or not? And they say we are not going to. So that's how I know the answer. I haven't written it in my email. I'm not going to show it to you today, but that is the summary. Now let's talk about the schedule. And here I made a typo, so I'm going to make sure that you get the correct version. So the schedule is as follows. You have an option tutorial. It's just going to show you how to click the button. I'm sure you can do that no matter what. You go through session 1, 1-1, 1-2, 2-2, 1-2, 2-2. I label them this way. They don't exactly call them 1-1 or 1-2, but this, for simplicity, I label them that way so you don't get confused. Session 1, okay, the first portion of session 1, we already talked about it, 100 items, it's 1 hour and 45 minutes. And then you have to submit your answers, okay? Don't think that you can just keep going. You have to submit your answers and then decide whether you want to take your break or not, okay? And then you continue with another 100 items, 1 hour 45, and then you have to submit again. Please submit your answers when you are done. It will automatically do so anyways if you run out of time. However, it is just good practice just to make sure you click that button so you have comfort in your heart. All right, now you have 30 minutes of what we call kind of the lunch break. It is optional. You can take lunch or not. I would advise you to take something to eat, okay? Your brain needs a lot of food and energy. Then you go to 2-1. 2-1 is 75 items, 2 hours. When you're done with those 75 items in 2 hours, you'll have to have a break. Again, optional, you don't have to, but advised to do so. And then for the last part is another 75 items in 2 hours. All right, so I think I made this clear that you have to submit after each portion. And although they say it's session 1 and session 2, it's actually 4 different sessions that is going on that day. All right, let's continue. Breaks. Breaks, we talked about it earlier. You can take breaks anytime you want. However, the clock does not stop for you, okay? This is not, again, your washing machine. You cannot play pause or your recorder or your Spotify. You just have to keep going unless it's one of those scheduled breaks. All right, so this was it for the 2019 guideline, what I really thought you needed for the examination. If you have any questions, my email is clairej@studentrdh.com, and I really want you to just focus here on knowing that we're gonna not use the 2018 perio guidelines, and we're not gonna use the new hypertension guidelines. Okay, I wish you the best in everything you do. And I'm just gonna quickly show my face again just to wish you the best. Go there a little bit more confidently, because you have reviewed the blueprint with me. And from that blueprint, again, there was a section when they have a lot of bullet points. Go through them one by one and make yourself some check marks if you know it. If you don't know it, find a book or StudentRDH or whatever you can to really understand the information. The NBDHE is probably one of the biggest things you'll have to do in your life. The good news is once you pass, you are completely done for the rest of your life. So I really wish you the best. My name is Clem, the founder of StudentRDH. My email is clairej@studentrdh. I will always be here to answer your questions and to cheer you on. Take care.